There's a small device about the size of a flashlight that researchers at a major university have spent the last several years studying in adults over 50. It doesn't require a gym. It doesn't require getting on the floor. It doesn't even require standing up. You breathe in through it against resistance for about 5 minutes a day. And in a randomized, double-blind clinical trial published by researchers at the University of Colorado Boulder, adults who did this for 6 weeks saw their systolic blood pressure, the top number, drop by an average of 9 points. That's a change large enough that in some patients it approaches what a first-line blood pressure medication can do. Since high blood pressure is one of the single biggest risk factors for stroke in adults over 65, a breathing exercise that meaningfully lowers it in 6 weeks, 5 minutes a day, is exactly the kind of finding worth understanding in full. Today we'll walk through exactly what this technique is, what the study measured and what it didn't, how blood pressure connects to stroke risk, and how to try this safely, including who should check with their doctor first. Let's get into it. The technique is called IMST, Inspiratory Muscle Strength Training. The idea is simple. You inhale sharply and forcefully through a small handheld device that resists your breath, similar to the effort of drinking a thick milkshake through a straw. It strengthens your diaphragm and the other muscles that power your breathing, the same way lifting a weight strengthens a bicep. Here's what the actual study did. Researchers recruited adults 50 and older with elevated blood pressure. Half performed high-resistance IMST for 5 to 10 minutes a day, 6 days a week, for 6 weeks. The other half used a fake, low-resistance version of the same device, a placebo group, so researchers could isolate the real effect. The group doing real IMST saw their systolic blood pressure drop by an average of 9 points. The placebo group saw no meaningful change. The researchers also found improvements in how well subjects' blood vessels functioned, how far they could walk before exhaustion, about 12% longer, and even measurable improvements in executive function, the kind of thinking skills that help with planning and focus. Now here's the connection to stroke specifically, and we want to be precise about this. The study did not track who did or didn't have a stroke. 6 weeks is far too short a window to measure that directly, and stroke wasn't what researchers set out to measure. What the study measured was blood pressure, and blood pressure is one of the most well-established, heavily studied risk factors for stroke that exists in medicine. Large population studies going back decades consistently show that even modest, sustained reductions in systolic blood pressure are associated with meaningfully lower stroke risk over time. So the honest, precise way to say this is, this breathing technique produced a real, measured drop in a major stroke risk factor in a rigorous, placebo-controlled trial. That is meaningfully different from saying the technique itself was proven to prevent strokes, and we want you to understand exactly which claim the evidence supports. Let's make this concrete. Consider someone like a 67-year-old with blood pressure that runs a little high, not high enough for their doctor to be alarmed, but high enough to be a quiet, ongoing concern at every checkup. This is a composite picture, built from the kind of participant profile described in the research, not a real person, not a testimonial. Daily walks help a little. Cutting back on salt helps a little. But squeezing in a structured cardio routine, 5 days a week, has never quite stuck. A common and understandable pattern among people managing joint pain, fatigue, or simply a packed schedule. Now picture the shift. 5 minutes each morning, seated, using a resistance breathing device, no gym clothes, no travel, no impact on the joints. According to the study's protocol, that's the entire time commitment. 5 to 10 minutes, 6 days a week. This is illustrative, a composite built from the study's described population, not a specific person's medical outcome, and not a guarantee that any individual will see the same 9-point change. Blood pressure responds differently across different people, medications, and health conditions. The researchers who ran this study were direct about one thing: check with your doctor before starting IMST. It is not automatically appropriate for everyone. If you have uncontrolled high blood pressure, a diagnosed heart condition, a lung condition such as COPD or asthma, or you're currently pregnant, this is a conversation to have with your doctor first. Forceful inhalation against resistance changes pressure in your chest and lungs, and your doctor is the only one who can confirm it's safe for your specific situation. In the study itself, a small number of participants reported mild neck strain or lightheadedness when starting out. These resolved and weren't serious enough for anyone to leave the study, but they're worth knowing about so you're not alarmed if you notice something similar. And importantly, the lead researcher on this study was direct that IMST is not a replacement for exercise. It didn't improve cholesterol, blood sugar, or bone density the way physical activity does. It's a complement for people who can't currently meet exercise guidelines or an addition for those who already do. We want to be straightforward about something most videos in this space skip over. This was a small study, around 100 participants in the primary trial over 6 weeks. That's enough to be a rigorous, well-designed, placebo-controlled study, which is genuinely strong evidence. But it's not the same as a large, decades-long study following thousands of people to see who actually has a stroke, the way we discussed with the dietary research in previous videos. The lead researcher himself has said this isn't a magic bullet, and that more research, including longer trials and direct stroke outcome data, is still needed before anyone can make sweeping claims. He's actively continuing this research for exactly that reason. The honest summary is this: a well-designed clinical trial found that a simple 5-minute breathing technique produced a real and meaningful reduction in blood pressure, a major, well-established stroke risk factor, D, in just 6 weeks, with a strong safety profile for most people. It has not yet been directly shown to prevent strokes because no study has tracked that outcome yet. Both of those things are true at the same time, and we think you deserve to know both. So here's the technique, stripped down to its simplest form: a resistance breathing device used for 5 to 10 minutes a day, most days of the week. In the study that produced these results, 6 weeks was enough to see a measurable drop in blood pressure, one of the most important levers we have for reducing stroke risk over the long run. If you're interested in trying this, the study used a specific type of high-resistance inspiratory training device, not just any breathing exercise app or technique. Look for one designed for this specific purpose and bring it up with your doctor before starting, especially if you're managing any heart, lung, or blood pressure condition. And one more time, because it matters, check with your doctor first, particularly if you have a diagnosed heart or lung condition, uncontrolled blood pressure, or you're pregnant. If this kind of research-backed breakdown is useful to you, consider subscribing. We go through published studies like this every week, always with sources, always without hype. And if you know someone whose blood pressure has been a quiet worry at every checkup, this might be the 5 minutes worth sharing with them.